Will Utah expand Medicaid or not? Frankly, I don't believe that that question presents a complete and accurate scope of the decisions that we face as a state. The fact is that many are rightfully concerned about expanding federal programs and how do we pay for that expansion. And as we look at a federal government that doesn't seem to be willing to live within its means. And just as many are concerned about forfeiting tax money that generates out of Utah, our hard-earned taxpayers' dollars, and then turning our back on our most vulnerable citizens. Legitimate questions all. I want to tell you that after a thorough analysis and careful consideration, I'm convinced today that the best pathway forward for Utah is not to pursue an expansion of the federal Medicaid program. Now, before you tweet that out, you in the press and everybody here, let me further explain what I mean by that. To be clear, while I am not recommending an expansion of the federal Medicaid program, I am prepared to pursue a block grant from the federal government to bring Utah taxpayers' dollars back to our state to be used in a unique Utah way to fulfill our responsibility to care for those who live in poverty amongst us in our communities. Members of both the House and the Senate have expressed a support for flexibility that would come through a block grant. I agree that it's the right concept, and we can start now with a state innovation waiver that will seek the flexibility that a block grant will give to us, and it will support a 3-year pilot program being developed here in Utah called Healthy Utah. During this 3-year pilot program, the state will use the block grant funds to help with Utahns who make under $15,500 a year. This Healthy Utah program will provide assistance to pay for health insurance in private markets. The exact amount of assistance will depend upon 4 factors: the individual or family's ability to work, their household income, access to employer or family health insurance, and their individual health care needs. All participants in the Healthy Utah program will help pay for the cost of their health care through co-payments. In addition, those with slightly higher incomes will pay up to 2% of their monthly income to help pay for the insurance premiums. As part of this pilot program, parents with children on Medicaid will have the option of bringing those children and putting them on, and their entire family on, their private market plan. I would suggest that family life is difficult enough today without trying to manage different health care plans through multiple networks with a multiple set of rules. So I think our families will appreciate this additional option that will come to them. We will also require the Department of Health to closely monitor, Dr. Patton, the pilot program, and report both to the governor's office and to the legislature as far as how this rolls out and the impact that this will have on our community. At the end of 3 years, this will allow us to evaluate how best to proceed as we go forward. We'll find out what we have learned about the health care needs of families and individuals in the state of Utah. We'll also understand the ability and the willingness of the federal government to live up to its commitments, and we'll also understand the impacts that it has on our own state budget. We can at that time make some evaluations and decisions as far as what we need to do going forward. I fully expect that this block grant program will in fact cover entirely the funding needed for this 3-year pilot program. By taking this course of action, we're going to also be able to reduce or close redundant state programs we already have in existence, and from those savings we'll be able to cover the administrative costs of this Healthy Utah program. By the way, there's $35 million that the House has talked about on the table in their program. That $35 million can now be redirected into other very important programs and needful priorities, such as expanding Utah's autism pilot program and having it also directed into educational initiatives that we need to in fact shore up. This proposal to create a uniquely Utah program to care for our poor rather than expanding Medicaid meets the principles I've outlined previously. I've long advocated, as most of you have heard me say at some venue in times past, that Utah can do more with less. If the federal government will just block grant us the money, take away the strings, and give us maximum flexibility, we will find innovative ways to do things better, more effectively and more efficiently. This is an opportunity for us to show that very thing. My plan to seek a block grant rather than simply expanding Medicaid will not only help us meet our moral responsibility to care for the poor among us, but it will, in fact, allow us to do it in a way that keeps the state in control and will help us work towards a healthy Utah.